Hi, everybody. Welcome to It's Going to Be Okay with Dr. Roseann. We're doing a live episode, and this is our neurofeedback. Ask Me Anything. I'm going to talk about all things neurofeedback. It's often misunderstood. There's lots of information out there in the world. Sometimes it's great, and sometimes there's just not information that's accurate. So what exactly is neurofeedback, right? So neurofeedback, just like really simply, I'm going to give you a simple answer, and then we're going to get into the nuggets of what actually is neurofeedback. And I know some of you are here because you're considering using it for your child or yourself. I certainly love it and have been doing it for a very long time and have been able to work with so many people and now all over the world because we do remote neurofeedback, which, yes, it's as effective as in-person neurofeedback, or at least through our brain behavior reset program. We are using EEG neurofeedback. We're going to talk about that. Don't get overwhelmed. So what's neurofeedback? So very simply, it's a way to provide feedback to the brain to help it self-regulate. And it's done through a process of computers where it does measurement and reinforcement. So it measures brainwave activity. Nothing comes through the wires, even though there's sensors hooked up at different places. It is really about, and again, we're using EEG neurofeedback. I'll explain why I do that. It's accurately reading the brainwave activity. The brain is getting real feedback about how it's changing, and the brain then gets reinforced through visual feedback and auditory. We use movies and videos. So when you're doing neurofeedback, the brain says, hey, Dr. Rowe has made this protocol and I need to increase this brainwave and decrease this brainwave. Typically is what we do. We're working on increasing one area and decreasing another frequency, right? And this is all done through a process. We're going to walk through the process. This is just high level. And the brain in 2 to 3 seconds literally will change itself, produce that exact combination of perfect brainwave activity. It's not going to last until you do a lot of sessions. But when you do that, the brain, 2 to 3 seconds, instantaneously produces this healthy combination, and it's getting this reinforcement. A movie playing or not playing, sounds, in our case, dinging or not dinging, and other sounds. And there are other reinforcements depending on the type of neurofeedback you are doing. So very simply, you are reinforcing the brain for producing a healthy combination of brain waves. And when that happens, a lot of things happen. So you're changing brain waves, which has its own functionality, right? So you're changing brain waves over the structure. You're actually changing how the brain is communicating with itself, which we're learning more and more through research that kids that have, people with neurodivergent issues like ADHD, autism, they actually have malfunctions in brain hubs. And that is a major reason why medications don't work, because medications go and improve structures. They don't address brain hubs. But what is neurofeedback? What is it a master of is improving brain hubs and getting the brain to communicate differently. So it's neurofeedback has been around since the late 60s. It is highly evidence-based. There are tens of thousands of research studies, well over 3,000 peer-reviewed. I'm going to say that all the time when I talk. And it's addressing every kind of issue you possibly can think of. So one of the questions is, what kind of clinical issues does neurofeedback address? So first of all, you have to understand a dysregulated brain, right? So a dysregulated brain can look different in everybody, right? So we're all struggling, we're just living through the pandemic. We all have a dysregulated brain. And hopefully you're doing things to improve it, right? I do certainly have done hundreds of sessions of neurofeedback. I do a lot of PEMF. And so when you're doing neurofeedback, you're really talking about a brain really simply. Is your brain overstimulated? is it understimulated, right? And when it's overstimulated, you see things like anger, irritation, impulsivity, OCD, when it's understimulated, you can see executive functioning issues. You can see anxiety in a different way. You can see inattention, all these different components. And yes, you can have a mix or both. But we look at where is that in the brain, right? Because we know, or I should say, I know, I've done well over 10,000 brain maps, and people come into me from all over the world. And you are looking at where is that dysfunction and how does it look in the real world? So anybody who's here who's ever had a brain map with me, give me a shout out, because you're probably, everyone always thinks I'm doing a psychic interpretation, because when you look at a brain map, I don't even need the clinical history. I can see what is happening. If this area is overstimulated, that means they're doing too much of that behavior. If it's understimulated, you're not doing enough of that, right? You might be loss of motivation, and it might be overstimulated, and you might be really impulsive. You might be a PANS kid and really irritated and have a lot of different behaviors. So you don't need a clinical diagnosis. You don't even need a clinical problem, because neurofeedback can be used for peak performance, right? So if you don't already know, it's used, NASA requires the astronauts to use it before space. All the major Olympians do it. A lot of high-level pro athletes do it. Some of them may start with a head injury and then they realize their brain works better than it did before. But it's really used to enhance your thinking. And so when we think about what are the clinical issues, there's basically not a clinical issue that I don't address. Yes, we focus really on kids, even very young kids, as young as 3.5. And we do PEMF for kids that are even younger than that or can't sit. We're going to talk about the process of actually neurofeedback. What does it look like? But what clinical issue is there, right? Some people come in with a clinical diagnosis. Some people, probably half of my people, come to me and they have the wrong clinical diagnosis, or they're missing diagnoses. So I use it for PANS and PANDAS. I use it for very complex cases. How do I use neurofeedback? How does it help my kids who have brain inflammation or agitation? Well, number one, neurofeedback is going to actually change the way the brain is working, right? It's going to help rewire it. It's going to create the brainwave activity, which is going to influence neurotransmitters, right? There's a lot of ways to support neurotransmitter activity besides psych meds, people. Okay. I could go on and on and on. Please listen to the episodes on that and read my blog. But it will help to get the brain actually working. Number two, it's going to support and take an overactivated sympathetic dominant nervous system, a stress nervous system, which can happen in everyday life. You don't have to have a single event. You could have compounded daily stressors. Your kid's got a learning disability and they have to work really hard. And the next thing you know, their nervous system is super activated, right? So it takes you down into a relaxed parasympathetic state. So when I have these very complex cases, which is all of my cases, but it doesn't matter if it's a more simple issue, right? And when I mean a simple issue, please know I know the impact is real. I am a mom of 2 kids with issues, so I understand very clearly, right? I always say I walk the walk. I don't just talk the talk, right? I'm living this too. So when you are calming that nervous system down, right, you have to calm the brain in order for learning to occur. That is really important. But also for my families that have kids with autoimmune issues, PANS and PANDAS, Lyme disease, they need their nervous system to be regulated in order for healing to occur. The body does not allow full healing when it's stress activated due to something called psychoimmunology. There's a stress response, all of its resources, its hormones, its neurotransmitters, your immune system goes to figure out what the stressor is. And that's important. And it's a big reason why a lot of failures happen. So we need to be mindful, and you have to regulate the nervous system. Neurofeedback is one way. PMF is one way. I like direct manipulation of the nervous system, but you also can do things like meditation and yoga. You know, you got a kid who's really agitated, depressed, anxious. It's going to be harder to do those things. Those might be goals you work towards, where neurofeedback doesn't require you to believe in it or like it. It's going to work. It works at a subconscious level. And that's one of the best ways to do that. So what clinical issues does it help? It can help a lot of clinical issues. And there's a lot of research to support everything from headaches, pain, anxiety, depression, learning issues. I think no matter where you place somebody and what areas you're trying to work on, I have people come to me who just want to work on working memory or improve the social skills of an autistic. You can get really global. Like, I just need all the symptoms to improve. I need these few areas to really go deep in. And a lot of people start out with wanting global and they love the results. And I do want to say, so people ask me what type of neurofeedback is best. So don't let anybody tell you that one neurofeedback is better overall. It really depends on each individual's needs. Now, I have had a lot of experience. I've been trained in many forms of neurofeedback. I do EEG neurofeedback primarily for a reason. Most of the brains that I work with are complex, and it allows for greater control versus doing CAP training, which is Z-score training, or doing plug and play at home. You know, there are all these systems out there, and I own quite a few things. Some of those are just good for stress relievers. They're not going to go in. EEG neurofeedback allows you to reduce brainwave activity, increase brainwave activity in very specific regions. And it's also amazing at that brain communication. And improved brain communication is quite dramatic in helping you process faster, make better decisions, calm down. There's just so many benefits. Sleep, you know, that can be really helpful. So it really depends on the clinical issue. And neurofeedback is really dependent on one thing, and that is the experience of the practitioner. I wish I could tell you it was something different. It is really 50% science and understanding what the brain is, what the regions, why we're training there. And the other 50% is a lot of experience. I actually get a ton of people who, 2 people in the past 8 days who came to me because they went elsewhere and didn't have the results they wanted, and in one case really declined. And the provider actually said that the person was falling asleep when they were doing neurofeedback, and the provider said they needed to take stimulants in order to do the neurofeedback. And the mother luckily said, that's just silly. That's why we're here, to not be doing that, and hightail it out there. And unfortunately had to get on an airplane literally across the country to do something. So the lesson in that is trust your mother gut, do your research. This was a provider that didn't deal with PANS. And this was a PANS case, and actually said, I don't work with PANS. And the mom, despite her good instinct, really wanted to just have convenience. And I understand. So somebody's asking, saying they didn't know that neurofeedback could be used with a lot of mental health issues. There is a lot of research for things from PTSD. I used it a lot with the Sandy Hook survivors. I've had many 9/11 survivors, and I always have the privilege of serving people who've had a lot of trauma. And so I think that we need to think about it for things. I use it for anxiety, very extreme cases of depression, complex layered cases, and as well as like my dyslexics and, you know, like my own child. So we want to be mindful. There is lots of research. And again, there are other forms of neurofeedback that could be beneficial. This is what I do, and there's a reason. So let's talk about what we do and how we start, because people need to understand the process. So I start with, and I'm going to share this with you. Let's go into what is the neurofeedback process. So our process is we start with a QEEG brain map. If somebody isn't local, we do what's called a brain check, and I'll explain the difference. And we only work mostly in the United States. It has to do with the hertz in your country. So we're at 60 hertz in the United States, and our equipment only works at 60 hertz. So the UK and whatnot, we have a different program. We do our coaching program, and we use PMF and a different form of neurofeedback. And we have to make sure it's the right fit and the right form of neurofeedback for you. So what is a QEEG brain map? This is my young JC getting a brain map. We put a cap on. It measures the surface electrical activity of the brain. It tells me what's working and what's not. And it also does a lot diagnostically. When you have somebody who's done 10,000 brain maps or more like me, I literally can look at that thing in 60 seconds or less and tell you exactly what is and isn't going on. I can see dietary components. I can see gut health. That isn't typical. That is because I've done a lot. So once we do this brain map or a brain check, which we do an intake first with a brain check, an intake second with a brain map. So when somebody is remote, fully remote, I sit, I meet with you, I determine if it's a great fit, and then we send you equipment, and then we collect raw data, and I statistically analyze that and determine what your best protocol is. That's our brain behavior reset program. You get assigned a specialist, and then I create a care plan. If you're remote, we show you how to use the equipment, which is, we have really dialed in how to use this equipment after 4 years. It's great equipment. It's as effective as in person. It just requires dedication, right? You do your neurofeedback sessions. We do a lot of coaching around wellness, how to amplify what you're doing. Neurofeedback, and really to maximize it, you do want to make changes in your lifestyle, right? You can't just keep having Doritos and then think the neurofeedback's going to fix it. You also have to work on some of those behaviors. And in our program, we look at your ecosystem. Like, is there parenting stuff that's not serving you? Does your child really need IEP support? We really try to help you, and so that you can add these brain keys and really get amplified results. That's how you do it. And then, when it comes to our PANS-PANDAS family, we look at what are your flares, what are things that would be helpful for you in that process. And people, so QEEG measures surface electrical activity, tells you exactly what's going on. People ask me questions. How many sessions do you need? Most people need about 2 to 3 sessions a week for about 5 to 6 months. That's why our program is a 6-month program. Sessions are about a half an hour. People will say, well, can I go once a week? No, it's like going to the gym once a week, Pete. It's not going to last. And that's why you need a lot of sessions. People then always ask me, are the changes lasting? If you haven't listened to the episode with Alex, please go back and listen to that episode. He is why I started neurofeedback. I did not do his neurofeedback. And here he is 20 years later, he's sustained the changes. So the research shows us that the changes are lasting. Anecdotally, that's what I see. But you've got to make lifestyle changes, right? You can't just go back. If you're a highly anxious person and you're not addressing those behaviors, then you really want to make sure you want to make sure that you are you're addressing the whole picture and you're making those changes. I find that to be really hard. So somebody's asking me a great question. How do we convince a spouse that doesn't believe in the results of neurofeedback? Well, it's kind of one of my specialty areas. I am in the suburbs of basically New York City here in Connecticut. I got a lot of intense people. Please know we work with nice people. We screen you out, right? Always know we don't care what your problem is. We care about your attitude to the problem. So there's a whole episode on how to talk to your husband or your spouse. I'm sorry, I don't mean to do that. But like about neurofeedback, about holistic treatments. And I'm going to tell you that 80%, that is conservative, of my intakes are essentially couples counseling, where I help them to get together on that point. So basically, why, often women are in charge of the medical components of our children, right? And so we do all this investigation, we do all these deep dives, and then we come to our partner and like, hey, this is what we're doing. They just don't have the knowledge, right? Guys, in general, my experience has been that they like data. That's one of the coolest parts about neurofeedback. It's one of the coolest parts about working with me. We do brain checks and we do brain maps multiple times throughout the process. We do about 40 sessions on average for people, and we do 3 brain checks meetings with me. So you really get to see what's actually happening. We also rate behavior. So how do you actually give them, get them doing it? So a lot of times they say, just go for the brain map. Just go in there, do the intake, see what happens. But there's lots of research. I have lots of blogs. Give them a podcast. If they're, there's so much information that I have putting it out there. They need to understand. I find that is really, really helpful. And here's somebody who says neurofeedback works. I'm glad you're doing it. Hopefully you're one of my peeps. I love it. It's been amazing. And, it is a hard thing to get your partner. It's certainly able to understand the investment of cost, investment of time. This is 6 months. This is like, you're going to be doing this, and you're going to be doing this 2 or 3 times a week. You're also going to be making some changes, both behaviorally and lifestyle. People always ask me, like, who gets the best results in your program? It's really pretty clear. So number one, they follow the care plan, AKA listen to Dr. Rowe. Why are you coming here if not? 2, they have a sense of faith. They have a sense of faith that they're that in above, but also in themselves. And they are much more comfortable with their decisions. Like, I know what it's like to be driving the worry train. You hear me talking about it all the time. You got to get off. You got to pick something. Maybe it's a dietary change. Maybe it's neurofeedback. Maybe it's, working with this therapist, and you're making it day 1. Not one day. Like, there's a lot of anxiety behind a lot of things. So having that sense of faith is really just instrumental in doing, really doing that. And it's important to really lean in to what's working and having that consistency and having that patience. And who knew we'd have kids with stuff? I say that all the time, but we do. We also work with adults. I know some of you are asking what we charge. That is something we talk about on a call. And you can go to our solution matcher if you haven't already, drroseann.com/help. It will walk you through, will match you through the right solution. Neurofeedback is definitely, like I said, an investment in time. And people will say things like, well, why would I come to you versus, going to somebody locally? You're getting an expert, and I am not doing this forever. So it is absolutely, I love it. I believe in it, but this is a lot of responsibility. Like, we have an unbelievable team. And when you work with us, you are getting a full team support. You're not just getting me. And we just work with a few people every month. But you definitely can go to drroseann.com/help. You can get more, and you can get on a call and you can learn about it. And if you already don't know about our magnesium coming out, you have to join our contest. We're doing a contest just for another week or so. And it's drroseann.com/win magnesium. And it's an opportunity to, when you share on social, to win magnesium. If you're listening to this at a later point, you can go to drroseann.com/magnesium just to get our multi-mag brain formula. I couldn't be more proud of this formula. You've been asking me this for years. And I am really working on these unbelievable formulations that are tasty and actually change the brain, and really have an impact in a way where you feel it. So please, learn more about it and helpful. Somebody's asking, about PANS and PANDAS. So, just know that a lot of people come to me for more extreme things. I have kids who, I just had a little guy who literally completed our program. He's doing amazing. I don't even know where to put him. He was so young. He was a young 4, like a little ADD, a little sensory processing, didn't have a diagnosis, but very impulsive, very bright. And so we were able to regulate him. He was getting kicked out of his school to being accepted in a completely different school that, is a little more academic. He's thriving. He's doing great. But a lot of people come to me for OCD, PANS, PANDAS, multi-layered. I've got learning disabilities and ADD and anxiety. That is really why people wind up coming. And a lot of people get to that point because they maybe didn't recognize the signs, or in PANS and PANDAS, it sort of flared. So I wind up doing a lot of post care for people spending years trying to support their child with PANS and PANDAS. I wish I had people who came to me earlier. Because of this podcast, people do find me earlier. You must regulate the nervous system. No healing is going to occur. It doesn't matter if it's anxiety or depression. You must regulate that nervous system. I mean, we're calm brain, happy family for a reason. So I love neurofeedback. If you're interested, absolutely go to drroseann.com and /help and get you on the path to where you go. We have lots of solutions that will guide you right to where you are. I hope this was informative. I'm going to be monitoring the comments. Please ask questions. The gist of it is you are really looking at the brain. You are walking the brain to a more calm, regulated state. And the research shows us that it's lasting over time. It's natural. It's safe. It is amazing. And I know that you might have a partner, or you might have a physician that's resistant. You don't owe anything to your physician. You don't owe anything to your psychiatrist. They hate this, but your partner needs to be educated and on board. And please, we'll drop in the comments those episodes. So, how to talk to your partner about holistic treatments. It was one of my first podcasts because it's not a joke. It's hard to get in alignment. So wherever you are on your journey is exactly where you need to be. Remember, day one, not one day. If you're doing something that's working, lean into it. If you're here because it's not working, it's time for something different. Anyway, so sending all my mamas and papas and aunts and uncles and grandparents a lot of love. It's going to be okay. You just got to take a step towards those solutions.